The concerns over healthcare reform rage on. William Hoagland, Vice President of Public Policy at Cigna, joins us from Washington to discuss his prescription for reform. Mr. Hoagland, welcome to Bloomberg News.
Good afternoon.
Sir, how would you categorize the debate over healthcare reform right now? You know, we've been seeing a lot of this video of angry Americans at town hall meetings, and to a large extent, the White House has portrayed the insurance industry as the villain. And the House Speaker Nancy Pelosi even went so far as to call the industry's profits, quote, immoral. What's your take on all of this?
Well, first of all, I think that let's deal with the issue concerning the industry itself and immoral. Number one, the industry itself has been out in front and has been at the table working very hard to support health care reform. Indeed, even before President Obama was sworn into office, the industry itself came together with a series of very important reform options, including guaranteed issue, individual mandates that are enforceable, no pre-existing conditions, a modified rating so that you did not rate on the basis of health status. A number of issues that the president is saying, beating up the industry on. The industry has been there well in advance. So I think, first of all, I think this is let's be honest, the insurance industry is an easy industry to pick on. In terms of its profits, I think these are always overstated. Anywhere from 1 cent to 3 cents out of the dollar actually goes to insurance in terms of the profit. So I think this is unfortunate that the industry has had to be the kicking boy in this debate particularly during the last month.
Mr. Hoagland, but as you're aware, some of the Democrats on the Hill say that that is justified, and you're saying that you've been out in front, the industry's been out in front. Why have we not been hearing a lot more about that then?
I wish I had an answer to that. It seems to me that the industry, led very effectively by Karen Ignani from the American Health Insurance Plans, have been there working with the administration. Again, it's easy to pick on the insurance industry. Nobody likes to pay insurance. Nobody likes to get sick. And particularly when you're sick, that's the last thing you want to worry about. But I think there have been issues over the past. I think if you go back to the 13, 14 years ago, there were issues. But it seems very unfortunate to me that the industry has to be the kicking boy here when they have come forth with a number of proposals that are fundamental. And quite frankly, even as this discussion goes forward with health care reform this last month, we still are there saying we should have reform, and we support reform moving forward. So I find it difficult, but as I say, I accept the fact that the insurance industry is an easy group to pick on.
Mr. Hoagland, do you think that the bill will pass with that public plan that will compete with private companies, private insurance companies?
I don't think there are the votes in the United States House of Representatives, nor do I think there are the votes in the United States Senate to pass a health care reform at this proposal at this time that included a government-run option.
What about co-ops?
And I think I worked on, as you know, Mark, I worked on the Senate Budget Committee for many, many years. In fact, was there at the time that Senator Conrad first joined the committee, and now is chairman of the committee, and I respect Senator Conrad immensely in terms of what he's trying to do. And what I think he's trying to do is find some middle ground here that will allow for a non-government, non-profit, consumer-oriented operation that would provide an alternative to a government-run option. Now, to be honest with you, I think the details are still to be scoped out. We have had some experience in this country with co-ops. I think up in the Puget Sound area, there's been a health co-op. There's been one in Wisconsin, and quite frankly, they have not shown, from what I know of those plans, has not been as successful in, quote, bending the cost curve as you would like. So I still think there is an opportunity here. We should look at it. We're not ruling them out. And I think to the extent that they are non-government, non-consumer-oriented, I think there is a possibility that the co-op approach could take could possibly come forward in the month of September and going forward. But again, the devil's in the detail, and we'll have to see.
William Hoagland, Vice President of Public Policy at Cigna. Mr. Hoagland, hopefully we can have you back in the not-too-distant future to discuss this a little further, sir. Thanks.